I want to talk about the power of story, but I want to start by proposing a question. And the question that I want us to think about today is, what is the difference between 20 and 24 million? So those are both estimates from the Congressional Budget Office and others on the number of people that might lose health insurance if the Affordable Care Act was repealed. Now, one way to answer the question is simple. It's 4 million. That's a huge number. It means that potentially 4 million people's lives hang in the balance. But another way to answer the question is zero. There is no difference between 20 and 24 million, just as there's no difference between 10 and 20 and 30 million. And I say that because those numbers are too large. They're too abstract for our minds to meaningfully grasp. It's not the way that people think. It's not the way that they reason. It's certainly not what moves them to action on the behalf of others. So on a policy level, on a political level, on a public health level, there's very little difference in the motivational force to try to impetus for people to do something new or try something differently between 20 and 24 million. So you might say that the mathematical delta between 20 and 24 is 4, but the motivational delta is close to 0. And so today I want to argue that the truth lies somewhere in between those two answers. The truth is somewhere between the obvious, the straightforward answer of 4 million, and the less obvious, the more provocative answer of 0. Because numbers are important, but numbers are only numbers until we give them life. They have to be put in the right context for us to help them have real-world impact. We have to know, we have to feel the lives of the people that are affected by those numbers. And that might seem like an obvious point. It's because it is. There's nothing new, there's nothing novel about what I'm saying. The idea that stories can be used to create change is one of the most ancient insights that we have, but I don't think it's one that we use effectively enough. We can do a better job of reaching people, whether they're patients or families or funders or policymakers, in new and interesting and more creative ways. So whatever your views are on the last presidential election, I think what is obvious is that people didn't necessarily vote based on facts or policies or character or temperament. People bought into a particular narrative, a particular story about what was going on in the world around them, and that is ultimately what carried the day. And so we can use this insight in healthcare as well. We can take the knowledge that we have, the knowledge that we produce, and we can infuse it with narrative to try to create change. And so when I'm talking about narrative, I'm really talking about two types of narrative. The first is the narrative that we've been talking about a lot today, the use of human narrative. That's patient stories, those are family stories, those are the stories of real patients and clinicians that are living in the real world. And we've heard so many of those stories today, and they've been so beautifully and powerfully told. But there's another type of story, and it's a story about the larger narrative around who we are as a country, who we are as a health system, how do the lives of patients and clinicians fit into that larger story of progress. And for that story, we need data. We need to tell the story of large and persistent and sometimes even growing health disparities for certain groups of Americans. We need to talk about research that has found that nearly 80% of individuals in genomic studies are of European descent. Only 2% are of African descent. Only 1% of Hispanic. We need to talk about how a lot of these problems of underrepresentation and marginalization will probably get worse as we move into an era of automation and artificial intelligence. We need to talk about how access to precision medicines, to genomic testing, are increasingly out of the reach of many people who cannot afford the cost of innovation. So for me, the idea that you can merge personal narrative with larger policies is one that has been ingrained in my life from the very beginning. So the first memories of my life are of my sister, who was lying inside of an incubator struggling to breathe. My mother went into labor at just 26 weeks, and doctors told my parents that if she survived, she would likely have profound cognitive or physical disabilities. Praying that she wouldn't, my parents named her Karishma, which means miracle in Hindi. So this was 1990. My dad was having some trouble finding the type of work that he wanted to do in England. My parents were considering moving back to India, and they thought that the social stigma around disability would prevent my sister from realizing her full potential. 1990 was also the year that the United States was passing landmark legislation, the Americans with Disabilities Act, which declared that physical and mental disabilities in no way diminish a person's right to fully participate in all aspects of society. And I think that that law, that sentiment, played a huge role in my parents' decision to move here, to move to the United States. And it ultimately allowed my sister to have all the opportunities that she needed to thrive. So she was ultimately diagnosed with cerebral palsy. She uses forearm crutches to get around, but she's never let that stop her from doing any of the things that she wants to do. She's been able to ski and horseback ride with assistance. She was valedictorian of her high school. She went to an Ivy League college, and she's now practicing as a radiation oncologist in New Jersey. And so hers is a story of progress. It's the story of how, when we have the appropriate policies in place, it can really allow people to thrive.